Welcome to the session, Women Bleed Too. My name is Nicole Scappi. I work at NHF and I have a bleeding disorder. I'm excited to introduce our expert, who is the Medical Director of Inherited Bleeding Disorders Clinic of Southeastern Ontario, Canada, Dr. Paula James. We're super excited to have Paula with us today to discuss the societal and practical challenges in diagnosis and access to care, particularly with women. I'd also like to welcome our other panelist, Nabila Husseini. Nabila is from India and has an ultra-rare factor deficiency. Nabila serves on the executive committee for her chapter in India and is the women's group coordinator for the Hemophilia Federation of India. NHF has a wonderful relationship with India's Youth Society and their women's group, as we've worked with them a lot over the last few years. Nabila, we are grateful to have you here with us today, and Nabila will be sharing her experience with getting a diagnosis and access to care in India. In addition, she will share how she is and was viewed in her culture and community. But before we begin, I wanted to quickly discuss how you can get the most from this session. So you can utilize the chat box to write questions and comments, and the speaker will respond in the chat throughout the session. Second, make sure to give additional feedback by filling the evaluation out at the end of the session. And last, a recording of this will be available online for you to watch. So with that being said, I'd like to welcome you again and pass it over to Dr. James.
Okay, so thank you so much, Nicole, for inviting me to speak today. And thank you to NHF for having me talk about a subject I'm very passionate about, which is women and bleeding disorders. And the title of this presentation is Women Bleed Too. So these are my disclosures. I have research support from Takeda, CSL Behring, and Bayer. So in the next 15 to 20 minutes, I'm going to cover the burden of bleeding and bleeding disorders in women. I'm going to talk about some of the barriers to care that I've seen from my perspective, but we're obviously going to hear so much more about that from Nabila. And then I'm going to talk about some efforts to create resources to address those barriers. So in terms of women's bleeding symptoms, there have been some major changes over the years in terms of the frequency of menstrual cycles. And so in the past, women would experience about 160 menstrual cycles in their life. And women started their periods later and had more children than they do today, with longer periods of breastfeeding and earlier menopause. Whereas currently, women experience on average about 450 menstrual cycles in their lifetime. Periods start earlier. We generally have less children than in the past. Breastfeeding periods are shorter, and menopause happens later. So disorders that affect menstruation, you can see, are obviously having a much bigger impact now than they were before. And I want to recognize my friend and colleague, Dr. Rochelle Winikoff, for this slide. In terms of heavy menstrual bleeding or menorrhagia, this is a very common problem. So up to 30% of women at some point during their reproductive years report difficulty with heavy menstrual bleeding, and about half of those seek medical attention. And of those who seek medical attention, a number of studies have shown that somewhere between 15 and 30% of those women have an underlying bleeding disorder that's contributing to the heavy menstrual bleeding. And so this is really an important problem for all of us to be aware of. In terms of other bleeding symptoms that we see in women who have bleeding disorders, we also see difficulty with postpartum hemorrhage. We can see women struggling with hemorrhagic ovarian cysts that sometimes rupture and become a life-threatening bleed. We see other bleeding symptoms that are also experienced by men with bleeding disorders, so easy bruising with minimal or no trauma, nosebleeds, bleeding from the mouth or with and after dental procedures, surgical bleeding, bleeding from the gastrointestinal tract, bleeding from minor wounds, and then in the more severe cases, joint and muscle bleeds. The impact of bleeding disorders in women, particularly the symptom of heavy menstrual bleeding, has a major impact on women's lives and girls' lives, including work and school, absenteeism, Heavy menstrual bleeding causes 2/3 of hysterectomies in women of reproductive years. It can cause iron deficiency anemia, which can have a major negative impact on quality of life. There are a number of bleeding disorders that we see in women. The most common, arguably, I think, is von Willebrand's disease. We also see women who are carriers of hemophilia but who manifest a bleeding disorder themselves, and there certainly is a move towards recognizing those women as having hemophilia as opposed to just using the term hemophilia carrier, which doesn't really acknowledge the bleeding issues that many of those women experience. Women can have platelet function disorders and have significant issues with bleeding as a result of that. And we can also see factor deficiency, clotting factor deficiencies in women. And we're going to hear Nabila's story with her factor deficiency. So if we look at how common inherited bleeding disorders are globally, the World Federation of Hemophilia estimates that 1 in 1,000 individuals has an inherited bleeding disorder. And so I'm Canadian. If we look at the Canadian numbers, that means somewhere between 35 and 37,000 Canadians has an inherited bleeding disorder. However, if we look at our national registry, far fewer are registered. And the registry probably has missed some individuals who have been diagnosed, but when only 4,000 have been registered, the point is that many have gone undiagnosed, tens of thousands, in a country with universal health care. And I would argue that the majority of those who go undiagnosed are women. And the reason for that is that there is no debate or there is no doubt if a boy has a bleed into a joint that that's abnormal and requires further attention and investigation and treatment. When the most common symptoms experienced by adult women are periods and postpartum bleeding, those are periods of time when a certain amount of bleeding is physiologic, and so it can be quite difficult to sort out how much bleeding is abnormal and where does that trigger the need for additional investigation. And so just to speak a little bit more about that in terms of other barriers that I've seen to diagnosis and care, one important one is I think there is a discomfort discussing heavy menstrual bleeding and discussing postpartum bleeding as well, and social stigmas and taboos against an open sharing of what women are experiencing. Because I'm talking about inherited bleeding disorders, a woman may have inherited a disorder from her mother. And if both experience heavy menstrual bleeding, there can be a normalization of that within a family or within a household. Unfortunately, I think historically there has been a lack of understanding of normal versus abnormal bleeding within healthcare providers, especially when we're talking about gynecologic and obstetrical bleeding. Additionally, the lab tests that are required to diagnose inherited bleeding disorders are challenging and are not widely available. And that's an important barrier for people living in geographically remote areas, even within Canada, but also living in countries with other kinds of healthcare systems where expensive lab testing may not be widely available or available at all. I also think that there's a problem that's becoming increasingly discussed in 2020 about the lack of research and the lack of data involving women. And there's a recent book that I've read called Invisible Women, and you can see the author on the slide. And it talks about the fact that the healthcare system, I don't think, is deliberately negligent towards women's healthcare issues. It's that we haven't been involved in the studies, and there is a lack of data around the issues that we are facing. And so we are invisible, and the system was designed based on the data that was available. And so all of us need to challenge this and make sure that women are being represented in data sets and in research that then is used to inform guidelines and policies about healthcare. So to offer some hope on this topic, there certainly have been a number of efforts that have been undertaken to address these barriers. And I want to acknowledge Nicole's work and the work of NHF to address that simply by having a session like this and a track in their conference for women with bleeding disorders. Personally, my group has developed a website, and you can see the homepage of the website here, called Let's Talk Period. And we're trying to raise awareness about the fact that 1 in 1,000 individuals has a bleeding disorder, but most don't know it. There are other similar projects that have been undertaken in different countries. This is the homepage of a website called Know Your Flow, which has been launched by a fabulous friend and colleague, Dr. Michelle Lavin from Ireland. And then NHF has the Better You Know site, which provides resources that would allow women and men to understand if they are at risk of having a bleeding disorder and what the next steps are that they should take. In terms of Let's Talk Period, just to talk a little bit more specifically about some of what's on that website if you're interested in having a look. In the red circle here is a link to something called the SELF-BAT. And so this is the self-administered bleeding assessment tool. And this is a bleeding questionnaire that my group validated and published a number of years ago based on some important work that started in Italy in a region called Vicenza. And bleeding assessment tools are bleeding questionnaires that ask a series of questions about bleeding and then turn that story into a bleeding score that allows us then to decide how much bleeding, what kind of a bleeding score is normal, and where does that become abnormal and require additional attention. And so if you're interested, you're more than welcome to go on the Let's Talk Period site, take the SELF-BAT, and get an idea if your bleeding is within the realm of normal or if it's abnormal. And at the end of the SELF-BAT, there's a printout that you can actually take then to your physician that explains your bleeding symptoms and provides some advice about the next steps. We also are launching a number of additional resources on the website, including things that are on this slide. So we've just recently launched a toolkit for nurses to help them educate and empower and advocate for women with bleeding disorders. We've got a toolkit coming for primary care providers that will be launched very soon. We've got another one that's coming for teachers. So one of the things the Let's Talk Period project has done locally in Kingston, the city where I live, is we've done teaching sessions in grade 9 health classes around periods, what's normal, what's abnormal, talking about the importance of iron deficiency and how that's diagnosed and how important it is to treat. My team can't be in every classroom though, and so we're creating a toolkit based on the resources we've put together that anybody would be welcome to use. There are some video resources that you might want to have a look at, and then a bookmark highlighting the Let's Talk Period project that you're welcome to download and print. We maintain a number of social media platforms that are linked to Let's Talk Period, a Facebook page and an Instagram page. The number of followers continues to increase over time. The Facebook page has about 4,500 followers right now, and the reach it's starting to get close to 1 million, close to 900,000 right now. And so there certainly is an appetite out there for people to access this kind of information. And I've got a few slides here that just briefly cover the kinds of things that we talk about. So, you know, the tragic story of a young woman dying in a menstrual hut in Nepal. I had so many people message me when this movie, Period, End of Sentence, won an Oscar about how fantastic that was, that problem was getting that kind of global recognition. We've highlighted some stories, a woman from Ethiopia talking about how she was raised to believe her period was a curse. And we certainly hear those stories from women on the site. And then some real good news that's happening in the world today. New Zealand, other countries or cities or provinces making sanitary products freely available to girls so that they aren't having to leave school if they have their period and don't have sanitary products with them or can't afford them. We talk about the issues for working women. We talk about the issues for young girls and tools that are out there that might be helpful as girls start to have their period. And so with that, I hope I've convinced you in my firm belief that women with bleeding disorders are important and I think deserve the same level of excellent care as men who have bleeding disorders. But women face some unique challenges and barriers, and we're going to hear about that so clearly from Nabila. I just want to acknowledge my team that I work with, especially my nurses, Lisa and Megan, who are instrumental in helping me care for my patients. And with that, I'm going to turn it back to Nicole, and so we'll have the pleasure of hearing from Nabila and hearing her story.
10, 9, 8, 7, 6, 5. Dr. James, thank you so much for bringing the light to the barriers women are and continue to face with diagnosis, as well as some resources. For the next part of our session is going to be an interview format with myself and Nabila. So to begin, Nabila, would you please begin by telling us a little bit more about yourself and how you were diagnosed with a bleeding disorder?
Hello, good morning to everyone. A synonym for rare is extraordinary, and yes, I'm rare, but I'm also extraordinary. My name is Nabila Hussaini, and I'm parahemophilia with factor V deficiency, and I'm staying in Ahmedabad, Gujarat. In my society, where women are still treated inferior to men, if a girl has a bleeding disorder, society will question the family, saying, what will be her future? So as a female with factor V deficiency, I had to face many hiccups in my life where as I was access proper treatment, which is still prevailing. When I was 8 months old, I fell from the bed, which resulted in a cut on my lower lip, causing profuse bleeding. At the time, doctors were not yet aware of hemophilia and its treatment. When my bleeding did not stop, I was brought to the KEM hospital in Mumbai and was diagnosed as factor V. During the past 8 years of my volunteership as Assistant Regional Coordinator and Communication Coordinator of Women's Group of Factor V, I have seen that new developments in the care of people with bleeding disorders, especially in the treatment of hemophilia, gender equality, and outreaching have now been incorporated in the developing countries within the bleeding disorder organizations, which is highly applaudable. It is highly visible to see that the voices of women with bleeding disorders are heard and given equal opportunities. Along with voluntary services at the national and international level, I'm working as a content writer in an IT company, and I hope today's discussion will definitely make my voice loud and clear as a female with ultra-rare deficiency bleeding disorder.
Thank you so much for that introduction, Nabila. I'd like to ask you to tell me a little bit more about how did your parents feel about your diagnosis?
When my parents came to know about my bleeding disorder, they went through very emotional time. At first, they were very shocked to know about this, as before they never had about hemophilia. But gradually they became strong and were determined to face the challenges due to hemophilia and to make the most of life. When other family members came to know about me having hemophilia, they started showing sympathy towards my parents. But both my mom and dad were strong and said no to sympathy from the people, because sympathy sometimes makes people weaker. And my parents do not want their daughter to get weak emotionally, and so they raised me as their son.
Pretty resilient parents, Nabila. Well, let's fast forward a few years. Tell me a little bit about your experience in grade school.
Yes, hemophilia has definitely played a vital role in my life. My childhood was never normal. I was not allowed to play outdoors with my friends. My parents gave me each and every facility inside the house My schooling was also done under the proper care and of my teachers and principal, as my father gave them proper guidance and instructions about hemophilia and the first aid treatment to be given for that. Every time during lunch breaks in school, my principal comes to my class and asks me to follow her to her office. She used to hold my hand and while doing her work so that I do not run away to play with my friends. I did not enjoy any of the school picnics organized by school, but I was a bright student and I always actively participated in co-curricular activities like singing and dancing, drama, and debate competitions. So this picture with my bandages on my hand is when I was almost on the verge of the death due to brain hemorrhage, and it was like after that I went again for the testing for the for that particular disease, brain hemorrhage. My treatment was going in Mumbai, and my dad took this picture, and you can see the little girl laughing, although she was suffering from but she came back from almost verge to death.
That is an adorable picture, Nabila. So let's fast forward a few years after grade school. So can you tell me a little bit about your experience finding a partner with a bleeding disorder?
During my college life, I was not allowed to drive the vehicle like usually the teenagers do in USA. They drive motorbikes or cars. I was not allowed to drive any vehicle while commuting to the institute. I used to take public transport for commuting to my college. This way I completed my graduation, my education with flying colors, and obtained a degree in commerce and education as well. Due to hemophilia, like many personal problems also arose in my life. But in my life, like divorce, as my parents are very well versed with the difficulties that a caregiver has to face, they never thought about my marriage. But one fine morning, a family friend came in the proposal of marriage for the son uh, and guaranteed my parents that I will be in the safe hands as they have seen me since my childhood. Although they knew about hemophilia and problems related to it, my parents were like very transparent, and they advised them to visit my hematologist to make sure that there remains no doubt. But as life is very uncertain, I do not had any bleeding episodes in 6 months before my marriage. But after marriage, suddenly it started to happen one after another, which suddenly scared that person to whom I got married, and he just backed off within 2 months by saying that he cannot take the responsibility anymore with all these problems. Like divorce is considered to be a taboo for an Indian girl, but I make sure that my life and my parents' lives did not get hampered due to this. I got more active in the hemophilia movement. I started attending regional women's group meetings and thus felt more confident by listening to the stories of other women. The stories made me feel that my pain is nothing compared to theirs.
Thank you for sharing that, Nabila. You are a resilient woman. So switching a little bit along, well, I guess being along the same guidelines of that topic, can you share a little bit about others' experience with marriage in India that you have observed? Is it challenging to get married as a woman with a bleeding disorder in India?
Yes. Like it never ceases to amaze me that feminism in India is still a long, unsettled debate, which is still persistently prevalent in various forms. Women diagnosed with congenital bleeding disorders are stigmatized in many countries. This prevents from early diagnosis and a proper treatment plan. Approximately 1% of women have an undiagnosed bleeding disorder, which can diminish their quality of life and lead to life-threatening complications during menstruation, childbirth, and surgery. As mentioned, as I mentioned earlier, that divorce is a taboo, and for many women in India, many parents do not want to disclose their daughter's bleeding disorder while looking for a partner for her, as they are scared that what if a person will not accept her or rejects the proposal. I saw one case where the parents and the female did not disclose the bleeding disorder until her profuse bleeding while giving a birth to a child, and the doctor suspected that something was unusual and later found that she was having VWD. This brought many complications during the childbirth and in her life as well after that. But gradually everything got settled down. The second was the case where I saw the husband was supportive, but as per the culture and traditions as well as the narrow-minded mentality of her in-laws, she was asked to give a birth to a child who inherited the family. So all these prevailing thoughts and perceptions compel the parents to either opt for a decision of not getting their daughter married or not to disclose about the bleeding disorder before marriage.
So they were basically giving her an option, like she can either keep it a secret or she can disclose, and it's her choice to make that risk.
Yes.
Oh my goodness. Well, thank you again for sharing the perspective of some other women from a different community. And, that international perspective is just so unique and helpful to hear these women's stories. So I think that leads right into my next question is, why is it important to hear from others?
Whether I wanted it or not, my bleeding disorder has played such a huge role in who I am today. And my father became president of the Hemophilia Society of Ahmedabad chapter, the city where I live in, since 1999. And since then, he's serving as the president of Hemophilia Society Ahmedabad chapter. And I also joined the executive committee of my chapter since 2002. I believe in constant evaluation and to rainbow everything. Like over the years, I suffered different types of bleeds ranging from excessive and painful menses caused by an ovarian cyst, brain hemorrhage almost to the verge of death, to getting fractured to both in my knees and having spontaneous bleeds. But I'm so glad that joining the Structured Women's Group formed by HFI gave me a platform where my voice could be heard and I can make a name with dignity around the world. I got actually involved in the hemophilia movement as due to all the problems in my life, due to this hemophilia, I sometimes felt low, but looking to the problems of others, I feel that my pain is nothing as compared to theirs. Their problems are much more bigger than mine. And so looking into that, I became more strong, and I was like very firm and determined that I will help my blood brothers and sisters, because helping them gives me an immense inner satisfaction of giving back to the community, as though that as in that I also can voice my feelings that I'm also a female with bleeding disorder and I'm helping my blood brothers and sisters.
I couldn't agree with you more, Nabila. There's just something so special about this community and the bond that we all have. So my last question for you before we have a few minutes to do a Q&A after this, but I do want to ask you if you could go back to 4th grade Nabila, sitting in the office, having a teacher or someone hold your hand, that time of your life, what would you tell that girl today?
So I will say that don't worry if you feel you are different from the most other people. There is much more to you. There is much more to you than what others see on the surface. Being a girl does not make anything or harder for you. In fact, nobody really cares about it except for maybe you. You have strong parents as your backbone, so stop imposing imaginary restraints on yourself and go catch the world.
Oh, thank you so much for sharing that. And while I see this photo up here, do you mind just quickly telling me, go back one, keep going back if you can. It was the photo, but there was an individual in it I was going to ask you to highlight, but that's okay if oh, there it is. In the blues. Can you just quickly tell me a little bit about the person beside you in the blue and the picture on the left?
Yes. So I was the girl who was not allowed to go anywhere without my parents. And but in 2014, I visited the Philippines, which was my first solo trip. And it was more like a culture exchange, skills learning, and enhancing experience. So on the left side in the picture, the person is Andrea Trinidad, with whom I had stayed almost for the 12 days. And she was like, she made me feel like I'm living at my own house. Along with her, I visited Haplos Foundation, Hemophilia Foundation, and the program organized by them. And on the right side, the picture, the members of the Haplos Foundations are there. They organized a wonderful program, and there I met many patients and their families and learned about their feelings and problems. It was wonderful experience where I learned many things and which helped me to explore my strength and allowed me to work on my weaknesses to overcome them.
So to reiterate your point, community is key here, huh? I just think that meeting folks from other parts of the world, even if you're from other parts of the world, right, you just form that bond immediately. And that's just something so special, I think, in this community. So we do have a few more minutes left, and I'd like to take the rest of the time to ask Nabila and Dr. James a couple questions. So Nabila, if you wouldn't mind, would you mind clicking through your slides to the very last one? And if there's anything you'd like to say about your pictures before we ask questions as you click through them, feel free to say something.
This is my chapter's World Hemophilia Day celebration picture, where we just took out a rally, and we created awareness in the people by writing the slogans about hemophilia and everything on the flashcards. And it was a really wonderful experience when people asked us that, what is it about? Can you please guide us more about this? Because we wanted to know more about this. So it was a really very good experience by sharing to people in general.
That's fantastic. Would you mind clicking to the next one? Tell me about this.
Yeah.
Beautiful picture.
Thank you. And this is my last trip where I visited London and the Glasgow Congress. So it was like a wonderful experience where I learned that listening to others empowers and helps us lead to everyday lives without limitations. Listening to other stories enables us to be more realistic, as they might give us useful and insightful information. We may learn something we didn't expect or didn't think about. Sometimes listening to different life experiences motivates us and we understand them and feel their pain. So I think storytelling is very important, which the bleeding disorder organizations can implement by publishing them in their monthly chronicles or brochures.
I would agree with that. Thank you so much, Nabila. So if you wouldn't mind clicking to the very last slide.
That's it.
Perfect. And we're just going to leave that up there while we do our brief Q&A. So with that being said, I'd love to invite Dr. James back. And Nabila, please stay with us. But I'm going to pose you both two of the same questions. And I would like Dr. James to answer first. And Nabila, if you don't mind answering after her. So Dr. James, the first question is, where does your passion come from? That's a big one.
Yeah, from my patients. This is a really lovely group of patients to look after. It's very rewarding to have a woman come and see me in clinic and who, oftentimes there's tears in terms of the relief that somebody's actually listening to their bleeding history and taking their story seriously and offering them the chance for a diagnosis, because that's how you get to treatment, because we have such effective treatments for bleeding disorders. And so those experiences, I think, are what have motivated me to continue to work in this field and to say yes to invitations like your kind invitation to come and talk about this today.
Well, thank you, Dr. James. We are really happy to have you at these events. You can really see the passion whenever you speak and when you work. So I was really excited that you were on board for this session. So Nabila, the same question, I'm going to pose it to you now. Where does your passion come from?
The same thing, like when I see my father working since, because I'm a factor V deficient and I am not getting any factors, although he's dedicatedly volunteering himself as a president of the Hemophilia Society Ahmedabad chapter since 1999. And when I see the other patients suffering from pain and what I have not suffered, they are suffering much more than me. So the passion, this gives me a sense that I have to give back to the community by helping my blood brothers and sisters for doing something more, much more better, like some strong advocacy and like doing, creating awareness and everything, whatever is in my hands, I can do it for them.
Thank you so much. And then so this is the last question, and I'll start with you, Dr. James, and Nabila, you're going to wrap it up for us today. But my question to both of you is, what advice would you give to a woman with a bleeding disorder who is struggling to get a diagnosis?
Yeah, that's a great question. I think use connections like NHF or the World Federation of Hemophilia. One of the unfortunate barriers I think sometimes is if a woman comes to medical attention, she may not get the attention she needs and deserves. But there are many of us who are very passionate about doing this and who take great pride in providing care to women with bleeding disorders. So I think through organizations like NHF or WFH or the Canadian Hemophilia Society in Canada, you can find the names of people who are open to seeing these patients and who are going to take the problem seriously and who have expertise in treating heavy menstrual periods and in taking care of women so that they don't have postpartum hemorrhage. So that would be the advice I give if you come up against barriers, to look to the patient organizations to try to help you navigate through them.
I would definitely agree that that's excellent advice. And you made such a good point about, even if you do get to see a provider, they could be dismissive and you still won't get what you need from it. So it's very important to find that right fit for you and utilize the resources that you have.
Yeah.
Well, thank you, Dr. James. Nabila, what advice would you give to a woman with a bleeding disorder who is struggling to get a diagnosis?
Yes, in order to improve hemophilia care and treatment for people with hemophilia and allied bleeding disorders, especially for female sufferers, first, it is very important to have an adequate treatment infrastructure with more trained professionals who should possess the capability to identify and test women for coagulation screening. Awareness and education programs regarding women and women with bleeding disorders should be conducted. And I would also say to be like more transparent and not to hide anything about one's bleeding disorder, not only in personal life, but in professional life as well. Because when we disclose our bleeding disorder in professional life, it helps our higher officials to understand our problems, as they are also human beings. And they get more flexible, and when we take leaves due to bleeding episodes. So staying transparent would make our life easy and smooth going. Having ultra rare deficiency, I feel we need to shine a light on patients with rare factor deficiencies and demonstrate the needs and concerns through various programs. I'm lucky to have such supportive and knowledgeable and strong parents, because of whom I was diagnosed at an early age. But it makes me think of all the families with children with bleeding disorder who have suffered because they didn't catch it at birth. Therefore, it is very important to raise awareness of these rare bleeding disorders and do more research to get more answers. We need more testing to do worldwide.
Well, Nabila, that was about as a perfect answer as I could hear. So I don't really feel like I can add much to that. But with that being said, unfortunately, we have reached our time limit. So I'd like to just thank Dr. James, Nabila. I would like to thank you both for your time, as well as all the work that you put into the session. We truly appreciate your dedication to the community. And to all the folks watching as well, thank you so much for joining us today, and enjoy the rest of your conference.